Hello, I'm back. This is Dr. Radley, family physician in St. George, Utah, and this segment is titled, What About Masks? Okay, so first of all, as you have probably heard in the media, we have a shortage of healthcare supplies. So we are on a limited number of quantity of masks, including surgical masks and N95s, as well as gloves and gowns in our country. And face shields can be recirculated. When this first started, we couldn't get masks for our office either, and no one can. And the distributors were immediately contacted by the federal government and basically told this is how they will be allocated. That doesn't sound right. Sorry, it's late, but you get the idea. They're going to be allotted to different people based off of their priority. The federal government did have a backup supply that is rapidly diminishing. I can tell you that the state of Utah does have again, the coalition is gathering supplies and they are accepting donations from people who really don't need them to be able to be put to use on the front lines by our healthcare workers. At this moment, at least in my area, our community hospital has reassured us that we have an adequate supply of personal protective equipment, or PPE. We don't know what's going to happen. So we don't know how long that's going to go. So I've seen great posts of people on Facebook and families making homemade masks to be able to want to share. And I just want to say, first of all, I have the best patients in the world. I adore all of you. It is so hard being in my office and not being able to hug my patients, because as most of you know, that oftentimes when you're in my clinic, you're going to get a hug, and especially when you really need it. And so this distancing thing is difficult for me too. So I've had so many offers for people to make us masks. It just makes my heart warm, and I cannot thank you enough. But I want you to understand why we are declining your offers. So hopefully this will help explain things and help you understand for your own safety as well if you're using these masks, because again, we want you to use them with information and knowledge. That is power. So I'm going to just start with some basic science information. So the COVID virus itself is approximately 1.25 micrometers in size. The N95 masks, and I actually happen to have one. I'm being very careful with it because we have to make these things last. We don't have a lot of them in our community. But an N95 mask is rated for particle size of 3 micrometers. So if the coronavirus is 0.125 micrometers and a mask is rated for 3 micrometers, why is it working and why are we using these masks? So the N95 stands for filtering particulate of 3 micrometers in size or greater at a 95% efficiency rate. There are other masks that are out there that are in 100s, and usually those are your big doomsday looking masks with the special filters. You have P95s, and P95s are not medical grade. They're industrial grade, designed ideally to filter solvents from the air, so paint fumes or chemical fumes when people are working. So again, an N95 mask is a medically rated mask designed to filter out viruses, bacteria, and airborne particulate. So even though the mask will not filter down to the size of the virus, it is still protective because the virus doesn't float around primarily on its own. It is spread, again, primarily by respiratory droplet. That's how the mask is effective. So again, if the virus is smaller than that and it's living on a surface and you touch the surface and touch your face, yes, you can spread the virus to your mucous membranes in your face. But if it's from respiratory droplet, most respiratory droplet is 5 micrometers in size or larger. So the amount of debris that's going to get through the mask would have to be small enough for that virus to get through. So if you're in respiratory droplet and it's over 5 micrometers in size, it's not going to get through your mask. That's how the masks are protective, because the virus is in that respiratory droplet particle. Obviously, 95 is 95%. That means even with this best PPE, there's always a degree of error. And that comes in the filter process itself. It also comes in with handling of the masks. So a lot of people ask me, well, why aren't we all just wearing a mask in public to protect ourselves? And my son and I have been in some debates about whether or not shutting our economy down is the best thing for our country. He's a very astute child and very much into politics and accounting and finances. And so he has a hard time with this concept. He brings up frequently that Japan is not socially isolating. And that is true. Japan, primarily though, is having everybody in their country walk around with a mask on. So it's not that they're trying to, yes, Sherilyn, it is Riker. How did you figure? So it's not that they're trying to prevent them from inhaling in the respiratory droplet, because a regular surgical mask is not going to filter down even to the degree that the N95 does. It's that when they're wearing their masks, they're not projecting respiratory droplet out into the environment. And so to some degree that has worked for their country. They still have infections in their country and their numbers are still growing. So it's not a perfect system for them either. So again, the numbers of people that we have in our country, first of all, we just don't have enough PPE to allow everybody in our country to walk around with a mask on. Secondly, when people wear masks, they touch their face. And we've just said how many times tonight, don't touch your face. Because they put it on and it gets hot and they start sweating, so they readjust it or they adjust the nose piece. And that's the worst thing that you can be doing when you're trying to prevent from touching someone's face. Because if you did get a respiratory droplet on the outside of the mask and you touch the mask, touch your face, you just defeated the whole purpose of what the mask is meant for in the first place. So we're trying to make these particular masks last as long as possible in healthcare right now. And you have to know how to put them on and off properly to make that work. You can't be touching the inside of the mask. You have to remove it by the earpieces and let the mask come off. And then if you put it inside a breathable bag, such as a brown paper sack, and you let it sit, again, we said the virus should die off within typically 19 hours is our best guess scenario, preferably 24, then you can reuse the mask. There are other facilities around the country that are in the process of trying to find alternative ways of sterilizing the mask so that they can be reused as well. One of the studies I read that looks most promising this week is using hydrogen peroxide that is vaporized. And so it has a vaporized chamber that releases the hydrogen peroxide into the air, and then the hydrogen peroxide kills the virus, and then the masks have been tested and proven to be virus-free. So I do think we might see more of that coming. It is not rinsing the mask with hydrogen peroxide. It's a special vaporized chamber. If your mask becomes soiled, so again, be very careful touching the outside mask. If the mask on the outside becomes soiled, So you have a big globber of some kind drop on the mask. You have now broken that seal, that bond, and that allows the virus to penetrate easier. So your mask is now no longer of any use. Sherlyn says they're using UV light. There are studies on UV light as well. I don't know the data on those as well from what I've looked at. I can just tell you that there's lots of things around the country that people are trying to do to try to make their supply last as long as possible, anticipating that we're going to need far more than what we probably have countrywide. So let's talk about homemade masks. So having understand those basic principles of science, I just wanted to bring a few things to kind of demonstrate tonight so everybody kind of gets the concept. So imagine this little colander is an N95 mask. You can really not see me very well through it. It's filtering a lot out versus a bigger hole colander that would allow a lot more particle size to run through it. That's the difference between a N95 mask and a regular mask. Now let's talk about the masks being made in public. And so I used some extreme examples. I'm just going to use a flashlight. So again, can I tell you how much I love my patients in case you haven't heard that the first time around? I get things given to me all the time, which I would never in a million years ever ask any of you to ever give me anything, but I'm always so touched by it. And I get things like this given to me. This one was actually given to my daughter by another friend, but I get hot pads and washcloths, things that people make from home, and I'm always amazed by my patients' talents and skills and their generosity. So I'm just going to use a flashlight. I'm just going to shine the flashlight through this weave in this hot pad / washcloth, depending on what you want to use it for. You can see how much light comes through there. So obviously that's not really filtering a whole lot of anything, versus I have a piece of microfiber that has a very tight weave on it. And again, if I flash my light through there, you can see the light glowing, but you don't see a light coming through or filtering through. Again, the same concept with the masks. If you make a home mask, if your material is not designed to filter particulate size down to 5 micrometers in size or less, it is not offering a great deal of safety. Now, if someone's coughing massive respiratory droplets that would land on your face almost like spit, sure, it's going to protect you at least from that and keep you from having that land in direct contact to your skin around your nose and mouth. But short of that, it is not going to filter respiratory droplet of the size that you're not going to see, that's going to keep you from inhaling that in and getting sick. So as much as I love the idea of you wanting to do everything you can to protect me and my staff and those around you, I don't want you having a false sense of security by wearing these homemade masks and thinking that it's going to stop you from getting sick, because they won't. I can tell you that industries right now are aggressively working on ways to produce masks as quickly as possible, or using alternative materials to produce the mask as quickly as possible. They recognize the need, they know the urgency, and they're working on that. But I would be heartbroken if someone was using one of these homemade masks thinking that they're protecting themselves and wearing these out in public and happen to get sick because they didn't understand the basic science behind it. So hopefully that helps you understand why we have politely declined your offer to make us masks. Now, you could use that over the outside of a different mask to prevent some goober from getting on there, and it will help extend the life of the other mask. But really, that's about all that it's for. So if you have questions about that, you can message me and I can try to clarify that. But I just want you to be informed. I want you to be safe. Again, knowledge is power. This is Dr. Radley in St. George, Utah. Now, I do have one more video I'm going to do. It's talking about the future of healthcare. I think some of you might find this very interesting. Things that you may not be thinking about that perhaps we should be. So again, I'm going to take a short break to cut this one off. And if you want to share it, share the heck out of it. I would appreciate that. Make your friends aware. But that's why I'm trying to do these in smaller segments so that they don't run on for forever. So I'll be back in just a few minutes.